What makes the foundation unique and different is that it really focuses on a specific disorder and disease, trigeminal neuralgia. And this is it's a unique disorder, but it's probably one of the worst conditions, a pain condition somebody could have.
I think it's unique because it brings together scientists, clinicians, patients, and advocates for finding a cure for trigeminal neuralgia in one small group.
Science is a team sport, and when we look at these complex conditions such as trigeminal neuralgia, the more different views, different perspective, different knowledge we bring to the table, I think the better chance we have.
They have a passion for the research, for getting results. When we apply to the NIH, there's no emotion involved in it. It's all mechanical. But with this foundation, we have people that are genuinely interested. They want to see results. They're there supporting you.
I still remember my first meeting. I would say that was like 7, 8 years ago. At that time, I think we are just beginning to begin to understand the mechanisms. And now we are hearing so many promising therapies that's being developed and that's being moved into clinical trials. You can see the support across different sectors of the society.
How much have we progressed in terms of the sophistication? Tremendously. That's for sure, because in part because the condition has brought people into the interest in studying it, and technology has allowed new approaches to study. But it takes people to do it and to get people interested in it, and that's where the foundation has become seminal and important.
There are so many now promising avenues for treatment that we've just never heard of before. I believe that we're starting to see this ignition almost of new knowledge that's going to be brought to bear on trigeminal neuralgia just in the next few years.
Why is it so important to continue to fund this research? I either get money from the government or I get no money. And so if there is an organization, a philanthropic group that is interested in this condition and raises significant money, you are going to get more work done much faster.
It's not that we just design one study, we get one answer. We design one study, and then maybe we think about a couple of other things that we haven't thought about before as far as being a viable treatment. And so continuing to fund these studies is really critical.
Not only could you fund my research and the other investigators that are here, but we could find somebody else with another idea and give them a chance to help these patients.
It isn't that complicated, and I hate to say it, but it's about the fact that we have the science, but this stuff, these analyses cost money. We do need those resources, or we just can't go forward.
For patients that that have had the disease for a while and are losing hope, we've got a lot of probably the top pain scientists in the world working on this problem.
I am dedicated, as are many other people, to finding a solution. And I think that the approaches that are being taken, we're developing new drugs that we want to bring into the clinic, try for these conditions.
I think for a patient with trigeminal neuralgia, hope is going to be within their lifetime, most patients. Science is progressing at such a rapid rate now. Every decade, we almost double our knowledge of the nervous system. And I think the same thing is happening today that happened 20 years ago. I believe we will find a cure, or maybe several cures, within the decade from now.
I sit on several national grant research panels, and in the last year I have seen a tremendous increase in the number of what appear to be products that could relieve this pain, where I have never seen this before. And in these patients with trigeminal neuralgia is devastating and has no end in sight. But now I see an end in sight.